Good afternoon. My name is Lynn Goldman. I'm Dean of the School of Public Health and Health Services at the George Washington University. It's with extreme pleasure that I welcome you here to a very special afternoon at George Washington University. I'm thrilled to see so many students, faculty, alumni, colleagues, and supporters with us. In the U.S., we've made enormous strides in promoting equality for women. When I was in college, I did not dream of ever being the dean of the school. Nor someday that we would have so many women who are heads of states. We've had women as Secretary of State, even as a presidential candidate, women in positions like members of the Senate, governors, and CEOs. When I was in medical school, women were actively discouraged from going into certain specialties like surgery. And in the generation before mine, there were hardly any women in medical school at all. And so we've seen so much progress. But as they say, well, we've come a long way. We still have a long ways to go. She has visited Thailand, Cambodia, Honduras, Kenya, and many other countries in what's been a passionate effort to understand the root causes of poverty, social injustice, and inequality. And just recently, she received a master's in public administration from the Harvard Kennedy School. She also earned an honorary doctorate from Eastern Kentucky University in 2009. Please join me in welcoming Ms. Ashley Judd.
And just to say, to kind of connect it to the breastfeeding thing, if you can see the leap that my mind makes, you know, we have far too many uninsured children in this country, and it's such a drag on the economy. It really reduces productivity, and also it's just emotionally difficult for families, and it's very shaming, I think, for kids too. I mean, there were times when mom was in school and I was sick and I stayed home alone, because that was all that was available to us to do, you know, and she absolutely did the best she could, and the whole family did, but that's just what, you know, growing up in a single-parent home with a paycheck that's not equitable does to kids. I appreciated that you included that in your remarks, and I've been aware of gender violence my whole life, being a survivor of gender violence, and yet I was astonished when I went to graduate school and started to do a deeper dive on the numbers here in America, how prevalent rape and attempted rape is, particularly amongst young people. And am I correct that it's 1 in 3 college students to college women? I mean, that's a lot. So that's a lot of us in this room. That's a third of us in this room. And I think part of what's important, in addition to how we shape the narrative, is that we all have the courage to talk about it, because it's, you know, we're as sick as our secrets, and the shame keeps us in isolation. And when we find that shared experience, we gather our strength and our hope. So, for example, you know, I'm a 3-time survivor of rape, and about that I have no shame, because it was never my shame to begin with. It was the perpetrator's shame. And only when I was a grown, empowered adult and had healthy boundaries and had the opportunity to do helpful work on that trauma was I able to say, okay, that perpetrator was shameless and put their shame on me. Now, I gave that shame back, and it's my job to break my isolation and talk with other girls and women.
Any of our students, if you have any questions, I see one coming up.
And I also felt inspired by Appalachia, which is what made me want to pursue public health, just seeing the health disparities that plagues our hills and mountains. And I just wanted to ask, in a lot of the gender classes that I'm in right now, we talk about, like, what's the best way to address gender inequalities overseas? Is it top down? Do you start with governments? Is it grassroots? And I just wanted to know, you know, what your thought is.
It's both. It's both.
Hi, my name is Kavita, and I'm an MPH in epidemiology, actually.
Cool.
And I
love epidemiologists, by the way.
It's really fun.
Yay, epidemiologists, yay! I mean, I got the slam dunk education about malaria by one of the greatest epidemiologists in the world. I just love y'all. Oh, and if you're interested in knowing more about sex slavery in the United States, I highly recommend looking at the Polaris Project website. It was started by 2 kids at Brown. I'm telling you, you guys can change the world. It's amazing what you can do. They didn't know how difficult it is to pass laws in Congress because they were so young. And they got the original trafficking laws passed in this country. And they are largely responsible for the trafficking victims reauthors, you know what I mean. And of course, that's the one thing that'll end up in the paper, right? Passed. So I highly recommend it. And Kat Sean and I were classmates, and I would even suggest asking if you could go visit their offices. It's a very inspiring place right here in DC.
Wonderful. And possibly a place that takes interns. We have a lot of students interested in that. Yes.
Hi, good afternoon. I'm Meredith Waters. I'm a current senior undergrad here studying public health. And I know earlier and throughout this conversation, you've mentioned how important your faith is to you. And so I'm wondering how we can harness that to improve health globally, and also what challenges you've encountered, especially regarding sexual and reproductive health, as someone who is a religious person.
Wonderful question. I love your question. And that's one of the things that I did want to talk with you all about, because it's hard work, you know, and I don't mean that it's just hard work in terms of the hours that we put in and cognitively the uptake. It's emotionally hard work. It's hard to be with people when they're suffering, and you know, I've been taught that it's abusive to point out a problem without pointing out a solution. And I'm really clear that my work in America and abroad, I am just a surrogate for the people who are doing the grassroots work. We have one of the great public health Africanists in this room, by the way. See, I would have been her if I hadn't gone to Hollywood. She went to the Peace Corps, came home, got a master's, went back and ran the animal husbandry and fish program for all of Central Africa, and then became country director in one of the most difficult countries in the world, Democratic Republic of Congo, and did remarkable things while there. And speaking of religion and faith, when we first met at an international retreat some years ago, we were talking about exactly this. How do people survive? How do you not burn out? And she said, public health is my religion. So whatever works for you, work it.
What you've shared with us is so personal, wonderful, so well-informed. It's just been fabulous.
Thank you for having me. I
You're
appreciate
welcome.
it.
Thank you.
Oh, standing ovation from the mother. Thanks, everybody.